Is on my screen because that means the weekend is right around the corner. So thanks for joining us for this month's COVID office hours, and just thrilled to be with you as always. Um, just as we always do, we'll start with a moment of silence, a reminder that if you're in the WITSIC program, you want to keep your camera off because we are recording this for prosperity's sake. Posterity's sake, I mean. And you are being recorded. So let's start with a moment of silence, remembering all those who have fallen from COVID and racial violence and injustice and all the bad things in the world that we fight against. Great, thank you. And appreciate all that you do to fight back those evil forces. So, so glad to be with you today. Our agenda, we've got, as always, our welcome, some updates, and then we'll dive deep into some eviction moratorium stuff and CDC information and all kinds of really useful things for you to take back to your staff and your clients. So we'll go to updates. I don't see a slide for HUD, but I see Alana Cable's smiling face. So want to give you the opportunity, Alana, to mute and well, say hi and anything you've got on your desk that we should know about.
Good morning, John. Was that me that you wanted to present? I lost some of what you were saying.
We're always thrilled that you're with us. We don't have slides. We don't have a slide for
I don't
you.
have slides. I just have some information to share.
We'll take it.
All right. Well, good morning, everyone. It's wonderful to see you all, at least virtually. So just a couple of things to share. On our FY 2020 Continuum of Care grants, we have gotten operating instructions from our headquarters colleagues. So we're trying to go through those. We've had some additional training this week. I expect you'll start to see them begin to roll out within the next few weeks. We'll first focus on the first quarter grants that expire and we'll do it in that manner. So you'll start to see your COC grants come through. We are not using eSNAPs this year. It's a little bit of a different procedure, but we'll be getting your money out to you shortly. So I know that's always good news for all of you. As some of you know, we've begun our monitoring. It's all remote for 2020, but we're well underway with that. And we do have some staffing changes. Our financial analyst is going to be out on military leave for about 9 months. So I'll be reassigning staff workload next week. Some of you may get a new rep. So if you are going to receive a new rep, you'll get an email from us advising you of that. So just be on the lookout for that. And the other big news that I wanted to share, we don't have a lot of information on it yet, but as many of you know, through the American Rescue Plan, $5 billion of supplemental home funds were made available all across the country. Close to 58 million of that money is coming to Connecticut, and that will go to the state of Connecticut and our 6 other participating jurisdictions, as they're known in the home program in Connecticut. So in addition to the state, that will be the cities of Hartford, New Haven, Bridgeport, Stamford, Waterbury, New Britain, and the state, right? That's the 7. So all we have right now is the law itself. We will be implementing these funds by notice. We've been advised the notice will not come out until the fall. I have met a couple of times with the PJs by themselves and with many of you to just give them some general broad strokes of this funding, which is clearly tied to assisting those who are homeless or at risk of becoming homeless, fleeing domestic violence, If there's a veteran in the family and one of the preceding criteria I just spoke about identifies, it may help them as well. So I would strongly suggest, keep your eyes and ears open. As those of you that were on the call last week know, I'm encouraging everyone to at least start thinking about it and planning for it. It's 9-year money, so it's long-term development financing. And again, we won't have the notice telling us, exactly how these funds are going to be implemented until the fall. Our Office of Affordable Housing Programs and our Special Needs Assistant Program Office are working hand in glove to get that notice out the door as soon as possible. But it will have that tie to eligible populations. And those eligible populations, again, are those that are homeless, at risk of homelessness. And we're using the McKinney definition to define that further. Those fleeing or attempting to flee domestic violence, sexual violence, stalking, human trafficking, other populations who need support services to prevent homelessness, and veterans and their families that include a veteran who meet one of the preceding criteria. So broad strokes, what are the eligible activities? Tenant-based rental assistance, development of affordable housing, supportive services to qualifying individuals and families who don't already receive them, could include housing counseling, a broad variety of homeless prevention services, and acquisition and development of non-congregate shelter units. So a non-congregate shelter unit could be acquired or developed. It can be converted to permanent affordable housing, and that would have to be in line with our home statute. It could be used as emergency shelter under the McKinney-Vento Homeless Assistance Act, could be converted to permanent housing under the auspices of McKinney-Vento, or it could remain as non-congregate shelter units. We do know we already know of some suspensions, flexibilities that will come forward. As many of you may know, if you've ever worked with the home program, it is a very complicated program. It's our largest affordable housing development block grant. We really can't use CDBG except under a very limited circumstance to develop new housing. But we do know there isn't going to be a match, which typically is required. We won't have a commitment deadline. We won't have a CHOTO set aside. We won't have a maximum per subsidy requirement. We're going to increase what we're giving for planning and admin, and also allow funds for operating assistance to CHOTOs, for capacity building. And again, it's going to be implemented by notice. And we hope to have that more information for you in the fall. But please think about this, reach out to your participating jurisdictions. We're trying to do everything we can to at least foster conversation. So keep that in mind. And John, that's about it, unless anybody has any questions.
I love it. As I say, more money, more money, more money. And speaking of more money, my new best friend, Don Parker, is here to give us an update on Unite CT.
I love it. I love your whole entire enthusiasm. Thank you. It's a good way to start the Friday. So, hi everybody. Terry, I have to say hi. I'm so happy to see you. I didn't see you last time. Good to see you. So for Unite CT, there's of course a lot moving and shaking. We have we hired about 120 people last week to do the underwriting work, the case review work. So that doubled our capacity. And so right now we are onboarding and training and getting those auditors up and on track, which is going to be great to move files along. We still are seeing significantly incomplete files coming through. And so there's a lot of back and forth to get the documentation that's needed. And so what we're doing is we're going to the housing counseling agencies that we have contracted with 11 housing counseling agencies, and then with Southeastern United Way, since they don't have a housing counseling agency there. So we're going back to all of those direct level boots on the ground, and we're upping the capacity to be able to respond locally to really with the effort of getting these applications in complete. And that way they can move through the underwriting and be funded. So we definitely, we kind of thought it would, after the rush, it would be better quality applications, but we're really not seeing it. We have paid, just to give you kind of the stats, because we're in line still. It's still under 4 months for the average number of arrearages, which is what we thought we would see. So it's always good to see that we're in line. The average amount of arrearages that we're paying is $3,790 still. Really, we thought it was, just over 4, and we're still on track with that. The average utility is about $879. That's right in line with the national average still. And so we definitely, we're seeing that we're on track with what we expected. The income level that we're serving is definitely, we have our priority of under 50% AMI and over 90 days unemployed. The average monthly income is $1,591 of who we're serving. So we are definitely serving the more at-risk households. As far as like where we're serving people, it's spread throughout the state. Everything is like totally typical of what we see when we're running programs in the state of Connecticut, which is great. And we have funded $2,132,177 to date. And that's 341 households that have been served. So the numbers are definitely increasing and looking really good. Our systems continue to be like, we have the systems in place. And so now it's about bringing people who are trained to the table to be able to work with the files and the consumers out there. And then also we have with the HPP program that Lee facilitates at the department, we're doing a lot of work to make sure that those under 50% households with notice to quits get more attention, and that we're pulling them out of the system to know who they are, because not everybody is actually disclosing that they have the notice to quit or the eviction. So we're really trying to look to make sure we're not missing people. And I don't know if that's just because they're nervous to say that, afraid like it might be held against them or something, because that question is in the pre-eligibility screen. So that's kind of something that we're keeping track of too, and making sure to pull people out so that they get more attention. So that's where we're at with the Unite CT. The bus is doing a great job. So the bus is rolling 2 times a day throughout the state of Connecticut, and once on Saturdays. Really, it's like 100 people are showing up now. So it's definitely clicked. And the areas are making it be an event. So there's a lot of other services that are happening when that bus is in town, which is perfect. It's what we want to see. We've talked with our HCA1 partners and said, you need to follow the bus too, like you're the boots on the ground, and help that bus get, advertised as much as possible. So one story this week that was really like a kind of why we're doing it, and when it makes you really feel like you're doing the right thing, is the bus was in New Haven. And so there were well over 100 people that were served that day. But because the bus is also a hotspot, we have iPads that people use outside. So you have the computers inside, then you have the iPads outside. And then there was a line of people who had the QR code and they had their smartphones, and they were all doing their application right from their phone. So it was like they were basically getting instruction on what to do. They just wanted the confidence of having someone there to help them. And so it was really ideal for what we want to see happening with that bus moving around the towns. The call center still seeing over 1,000 calls a day. Our email is over 1,500 a day. And those are, a lot of repetitive questions. And some days we hear from the same person, 18 times trying to get somebody to help them. And then it's the back and forth. And you're like, I think I recognize this person. And so the boots on the ground is becoming, so critical for everyone to understand, like, this is whoever in the community that needs this help, like, make sure to reach out and make sure that you're supporting them doing the application, for sure. Because people are hidden and then they get very frustrated. And it's kind of like they could have been helped before, because it's actually not a tough application, but they're overwhelmed by the time they come to us. And so it's like elevated and they can't even hear it, so just to help with that kind of stuff out there in the community, for sure. So I can take some questions. I see that Jennifer has her hand up, and just keep track of my time because I go way too long all the time.
Hi, thank you so much for that update. I guess I just was looking for clarification on households who live in public housing. There seems to kind of be just community confusion a little bit around, can folks with subsidized housing vouchers apply for that program, and recognizing kind of what's preferred versus what's the reality of folks in those living environments and those programs right now. Thanks so much.
Okay, so all applicants, all tenants are eligible to apply. There's a lot of conversation around the housing authority because people's incomes determine what portion of their rent they pay in a housing authority. So HUD is your first go-to resort for people whose income has changed over the last year. They should be asking for a recertification from HUD so that their rent amount is adjusted. So we wouldn't be subsidizing the rental subsidy. So that is just to make that part clear. Now, somebody can apply from a housing authority just for the electric arrearages. If they have electric arrearages, that's totally no problem. If there's an extenuating circumstance in their house where that the recertification did not fully reflect something that occurred in their home. For example, if somebody died and there had to be a funeral, if somebody was sick with COVID and they have a lot of medical bills, there's certain things because of COVID that happened that there's extenuating circumstances. We need to know about those like on a one-on-one basis, because this is a household income program. We would not know the extenuating circumstance. So when there's someone who lives in federally subsidized housing, the COVID attestation form, that really does let us know what their story is. So if there's those circumstances happening, we usually would be able to see that and understand that it needs a special review. It's really not about that they didn't recertify their income. There's more to their story. In addition, there are situations in federally subsidized units where there's a minimum rent. And so if that person's income has decreased, if they had been recertified at 30%, right, and the amount that they would be responsible for is below what that set rent is, then we want to talk about that difference that can't be subsidized by their HUD subsidy. So that would also be, it really is an extenuating circumstance because we would not know that part. You know what I mean? We would see what the calculation was, say it was $500. We would see the $500 being calculated, but we wouldn't know that that was a minimum rent amount. So like there's explanation that has to happen. But there is a lot, we've done a lot of work already with people who are in housing authorities. So it's not a no, they definitely are eligible. It depends on what they need. The system, the software system has been updated so people can make a choice if they want to just have electric subsidy to be discussed. That's an option so that they don't have to go through the full application of having a landlord on the other side and all of that documentation, or they can just ask for the rent, or they can ask for both. So we've upgraded like the system to be able to kind of drill in that part too. The other important part of that conversation is that currently, because Unite CT currently has a 15% landlord write-off in the partnership agreement, HUD does not allow people to write off anything. So that's a barrier to, if they have arrearages, that we would, that would be hard right now for anyone to be successful with that. So there's conversations with HUD, you know what I mean, about like what can happen, what can be different. So those conversations have been happening at the governor's office to try to see. So.
Great, thanks. There was a question in the chat, who staffs the bus? DOH staff or community staff?
The host staffs they have volunteers that run the show. So the host is the local people who know like where the bus will fit. It's 50 feet long. If there's any need for traffic, if there's any need for, like manning the lines and things like that, if different towns have different rules about that. And so on the bus, there is the bus driver and there's a tech support person. And then at times there is a second person that is on the bus, and they're being hired. There's more people being hired so that we make sure that there's bilingual. But right now it's the host who really puts together to make sure that the languages in their community are going to be represented and that they have enough volunteers to man it and make it work smoothly. And then the housing counseling agencies, the local housing counseling agencies that are listed on our website, they also are outreaching to engage where the bus is, but the people who are hosting the bus can outreach and engage with them as well to get their support, which is really optimal because the housing counseling agencies now have been doing this Yardi software system for over a month. So they're really experts on it. So they can be very helpful in moving the applications through.
Great, thanks. Could you do me a favor and drop that link into our chat box?
Sure.
Have it front and center. I won't ask you to put in your email address. You were so generous to do that the first couple of times presenting to us, but I suspect now you're dodging your phone calls. So
yeah, the emails run like 280 to 450 a day right now for me. So I'm like, yeah, I don't really want any more, but I will get back to you if you email me. It might just not be as quickly as you'd like.
Thanks, Don, for all that you and your team are doing. And we'll circle back in a little bit and have you come back and give us an update. But thanks
Great.
for your time. Gonna kick it over, I think, to David Gonzalez-Rice, since I see him on my screen, but there may be somebody else who's gonna talk. David?
No, I think it's me. Good morning, everyone. Some of you know this news already. I just want to let you all know that I was promoted at CCH to the Director of Technical Assistance and Capacity Building. And what I think that may mean for some of you logistically is I'm an additional point of contact for some of our initiatives and services that previously were supervised by Mimi Haley. And am supporting a staff that was working without a direct report for a little while. So, my onboarding has looked the way that many of you have experienced onboarding in this sector and at nonprofit agencies, our steep learning curve. But for our YHDP and youth-related programs, I'm backing up Roy Graham. For our shelter diversion and financial services requests that are managed by Diana Berube. And for our training department, I'm working with and supervising Amber Freeman. So we're also in the process of interviewing and adding some capacity to some of those departments. And then, a note of apology to those of you I was working with on a couple of initiatives before moving into this role. This accounts for my radio silence, and I'm eager to dip back into a couple of those things as I get some of these pieces under my belt. So thanks very much, everyone. It's good to be here with you this morning. And reach out if you've got questions or want to have a conversation about those program areas.
Great, congratulations, David. So what I heard you say was you're doing 100 jobs for the price of one.
My email count isn't as high as Dawn's, so I'd really like to, if I could get that ticker up into that mid 200 range.
I love it. Healthy competition. Congrats again. So we're going to move to some of the updates. Specifically, the first one is going to be around eviction moratorium update. These slides have changed almost overnight. So I think Suzanne will probably walk us through those.
Yep, I am going to walk you through them. I'm also trying at the same time. I know, Liz, I can edit the polls right from in here. If you just click on poll right in the menu feature, sorry, just some technical work we've got to do because we'd like to do a poll in a minute. So I think that's the way to change it, but I can't do it now that we're on our slides. So good morning, everybody. Good to see a lot of your faces. Love to see more of you, whoever wants to turn on their cameras. Say hi. So there's news hot off the press. This happened. There was an order yesterday, excuse me, yesterday afternoon, vacating the current eviction moratorium. So it is on hold until 5/12 when there'll be another conversation on the ruling. So right now, people are only protected through May 20th. That's when it currently expires. So make sure you get help. There's a link right there. And, you know, people need to pay attention to this issue. But if the eviction moratorium, if this is upheld, who knows what we're going to be seeing. But folks who are behind, make sure you're checking in with them and helping them get connected to resources. The exceptions for people who are not eligible is that they owed rent before COVID happened, basically. Or they're a serious nuisance, or the landlord wants to reclaim that unit for their primary residence. So in those cases, evictions could proceed. So I don't know how much checking there is to make sure the person only has one residence, but anyway. There's new CDC guidance coming out, of course, every day. New information. What does it mean now that you're vaccinated? Do you need to wear a mask outdoors? Every day there's new news. There's still very little data on transmission in congregate settings. And we know a lot of you are in shelters or transitional housing or permanent supportive housing that's single site, or people are clustered in multi-family units. And there is some research with a nursing home. SNF is nursing home, sorry, for the acronym, that there is some look at that, but we don't really know what happens with vaccinated people in congregate settings. So really encouraging people to still be careful, to still promote mask wearing, and definitely, even if people are fully vaccinated, if they're immunocompromised, we want to make sure people are checking in with their doctors, and quarantine is still recommended if somebody is exposed to an active COVID-19 case. So not a lot of change. I think the vaccine's great, but changing our behavior in terms of wearing masks, socially distancing, keeping the windows open has really got to stay in place, because we still don't know exactly what it means to be vaccinated and all the protections we do or we don't get. This is good news. So you don't have to keep cleaning. Everyone who's been cleaning madly to deal with COVID, you know, the spike in those Clorox wipes and so on. Then I learned a new word here, is that the CDC has some findings on Fomite transmission. I didn't check on how to spell it, say it. But anyway, that's the risk of transmission of COVID from objects and items like clothing, like furniture, like the door handles, like all those things that everybody's been frantically cleaning. I mean, cleaning is still good. But anyway, they're saying that that's really not how you're going to get it. You're not probably going to get it. It's only 1 in 10,000. And that what we got to keep doing is what I just said on the last slide. So I'm repeating myself, is get people vaccinated, make sure we're testing, make sure the windows are open and they're getting ventilation, or you're thinking about your ventilation system if the windows don't open, social distancing and masking. So we're keeping it up even though we're moving forward. And then there's a resource there on facility ventilation considerations. I know this is a real challenge. Sometimes you're in an old property or you're in a property where they nailed the windows shut which is not what's meant to be. And so, taking a look at that for those of you who are running facilities, I know it's a challenge, but at least the weather's getting better and we can open the windows. Just some resources, the Johnson & Johnson vaccine is a one-shot, one and done, as they say, one-shot vaccine. And it rolled out, and there was some concerns about a level of percentage of people who, very low percentage of people who are getting pretty serious blood clots with the Johnson & Johnson vaccine. So they pulled it back out off the market. Basically, you couldn't get one of those for a while till they did some additional research and saw what the prevalence is of this. And it is now back on the market, but people may be having questions, need some support around that. And these are some messages that are important to have, I guess, in your toolbox if people want to talk about Johnson & Johnson. Remember, really promoting environmentalizing discussions of the vaccine and keeping a focus on that, but being prepared to have conversations with people so that we can help them. And, this is a fact, only a tiny number of people have gotten clots, only 6 people experience these serious side effects, etc. So to use that as a tool in your toolbox. Just a few more messages. And just the most important message is if a person doesn't want to get the Johnson & Johnson vaccine, and they prefer to get something else because of their concerns and they're not, reassured by this, then we should be offering help to where they can get the other vaccines. And now, as I understand it, we have lots of vaccines available. You can even get a $100 gift card in some places. In some places, you can get a beer with your shot, as they say in New Jersey. So we do have the availability of more vaccines and hopefully the availability for people to have some level of choice, both of place where they go and type of vaccine. So I just want to remind everyone, I'm talking very fast. So if there are questions that come up, feel free to raise your hand or put them in the chat. We talked about this at last month's steering committee meeting. HUD has continued to extend its waivers of the rules that have helped us during COVID. And you can link to that information. Make sure you notify HUD if you're going to use those waivers. If you are a direct grantee, if you are a subrecipient to DOH or DEMIS, they've already taken care of everything for you. But if you're a direct grantee from HUD with HUD, if you are continuing to, for example, waive the housing quality standards, then you want to make sure you notify HUD about that. Okay. Just a reminder that there are lots of resources with the American Rescue Plan. I mean, there's so many resources. Ilana talked about them. Dawn talked about them. There are emergency housing vouchers, which is another part of what's coming through this America Rescue Plan. We did mention it at our steering committee meeting, but it's a big resource. So we want to make sure people know about it. It's targeted to our population of people that we're working with. The public housing authorities will be administering these emergency housing vouchers. And HUD is supposed to let the PHAs know by 5/10 how many housing vouchers they're going to be allocated. So that's just, I believe, Monday. So keep in touch with your housing authority about these emergency housing vouchers. They'll be available for a few years and until they're used up, but they won't be renewed. So make sure you are connecting with your housing authority to know what's happening. The rescue plan has more money, more money, more money. Just keep John happy. More money, more money, more money. The economic impact payments, we're trying to keep you in the loop for this. A lot of people are eligible for this benefit, not only the people we serve, but the people who work in our organizations. Many of you may be eligible for these funds, and we want to make sure people get all the money that they are entitled to. So the IRS has a link to find out when your third round of economic impact payment will be coming or not. There's a link to create an account. People who didn't get their previous economic impact, EIP, I guess, economic impact payment, it's kind of a mouthful, may be eligible, but you have to file a 2020 tax return, even if you don't normally file. So there's a little bit of bureaucracy. And then also just knowing that there's additional benefits for unemployed people. And I know that some of the folks we're working with are getting unemployment. There's a federal supplement of $300 a week. So another thing to be aware of. You can file to claim your EIP after May 17th, and you can see that the time frame. And there's a link, and this is important, economic impact payment training for case managers. So giving you some tools and resources that you can use, hopefully, to help people. I'm not sure what FAQ like these is. I actually made that comment in this PowerPoint, but there are a couple of FAQs that we thought were important, is that people who are incarcerated are eligible for EIPs, and that people with Social Security numbers who are married to someone without Social Security numbers are eligible for EIPs. I don't think my staff is commenting on my thing, so I'm just going to move right along. So make sure you reach out to the great resources at Connecticut Association of Human Services. We heard from them at a previous meeting. Get your money faster, get set up with a bank account, make sure we're linking people to this resource, and volunteer income tax assistance. So if people do have to file, at least they can get some help filing. So that they can, oops, and they clicked on the link. Sorry. Now I have to, that's the danger of being live here. I cancel that. Okay. Just a reminder, we mentioned this, the child tax credit and the earned income tax credit, which is expanded to more families. It's available no matter what your immigration status or your tax ID is. 17-year-old people can get it. And that's the child care credit, and you can see the amounts. And then the earned income tax credit for people who are not raising children has been raised annually, and the income cap has raised to 21. So this is expanding eligibility for these benefits, and these tax payments are being paid by the IRS in advance. So people should be on the look at them, out for them. Make sure people are filing their taxes. I know that that's an issue for folks, but it is going to be, a lot of this stuff is driven by filing your tax returns. 2021 isn't even due yet, but it's due next week. So, but they are looking to make sure people have filed in 2020. Just remember, people are not going to have to pay it back if they're low income. So while the IRS is sending out payments proactively, you are protected from having to repay it if you're a single person making less than $40,000, or you're a head of household under 50, or couples under 60. Okay.
Right. Take a breath, Suzanne.
Yeah, I'm going too fast. I didn't realize we had plenty of time here.
No,
So
that's good. We'll just pause for a minute. And are there any questions on all of those?
yes, there's a lot of resources out there.
Resources. Just a reminder, as Suzanne referenced, anything that's underscored in green is a link, a live link. So when you get the slide deck, you can click on any of those links, and it'll take you directly to the resource that it refers to. Any questions? You're making sure that you and all of your clients and staff are getting your fair share of the American pie? Okay. So we've been doing this for about a year, and I'm not running out of hats. That's not what is motivating this conversation, but we're just wondering if these COVID office hours are something that is beneficial to you or not. Do you come just to see my hats, or resources that we're providing? Are there topics that you've asked for that we're covering and that you'd like to see this extended for the next couple months, ongoing, whatever? So we would like for you to turn on your cameras if you haven't, or use your,
launch it, guys.
use your buttons, reactions. Here's the, for those of you who are not on the phone, we've just put up a poll, or for those of you who are on the phone, we've just put up a poll. And the question, the one question is, should we continue COVID-19 office hours? And the 4 choices we're giving you, but you can write in other options in the chat if you want, are, yeah, let's continue each month. Or, hey, summer's coming, let's take a pause until September. Or, because we meet once a month for the steering committee meetings, let's incorporate the COVID learnings and slides into that slide deck. And then we'll make sure that folks who just attend these COVID office hours are encouraged to attend the steering committee meetings as well, or instead of these. Or we are done with these COVID office hours, no more. So those are the options we came up with. And before we go to the poll, are there any questions that folks might have? I don't know that.
Well, and there are 29 people who have already responded to the poll, John, so people are jumping right on it. We'll share the results in another 15 or 20 seconds, so everybody can see
in that case, forget what I was going to say. Take the poll. Jump on, make your selection. There's 46 people in the room, so let's hope to get over 40 responses.
Yeah, so far 32 people have answered the poll, so I can play my little music to get people's attention.
I was so busy talking, I haven't voted yet.
Oh, well, then you're keeping the numbers down. You're keeping the numbers down. Okay, we're at 34. John, have you voted? Everybody vote.
Everyone.
36, we're at 36. And then, Liz and Lauren and I won't vote. So that's a few of those votes right there. We're counted in the 42
if
as
there's
well.
Anyone on the phone who can't use the survey and wants to unmute yourself and give us your suggestion, we'll take it that way. Send us a carrier pigeon, Morse code.
Well, people can unmute and just talk too.
Yeah.
All right, I'm going to end the poll and share the results.
Great.
Because I'm hopefully showing the discussion slide, because we hope that we could do a little discussing now too.
So you like my hats? Do folks, we want to encourage discussion in these meetings, and we thought this would be the topic to encourage conversation. Should I call on people? Nikki? Anyone I can see is fair game.
Well, and folks can put in the chat or just unmute yourself or say when, and I think we put some other prompting questions on the slide about what's been helpful, what you're needing some help with too. Says maybe it's not office hours, but there are other COVID things that maybe are challenging folks. So does everybody kind of fried?
And you want to have the meetings every month. Are there particular topics that you want us to cover? It could be that you simply like the socialization aspect of these, and we could build in some activities that simply break down the isolation. We could do small groups or rooms with questions like, what's Terry Nash's favorite color? Let's do a survey on that. Or so
is there hand raised, John?
Okay.
Kathy Ziner, can you see that?
Nope. So why don't you call out the folks whose hands are raised, because I can't see them.
Only Kathy Ziner.
Kathy Ziner.
Well, of course, I appreciate seeing everyone and miss everyone. So that's one thing. But most importantly, what I am appreciating about these sessions is some more information about what's coming out of the federal government with regard to the ARP. So Alana's information this morning was really helpful and interesting to me. So I would appreciate having these for another few months yet while that's still evolving and some of these other kinds of technical information is coming along. So rather than pause until September, I'm more inclined to say, let's have them and then reevaluate in September.
Great. Other comments? Are there topics that come to mind that you want us to explore and create a slide deck on? Well, you know where we are, so maybe you guys your stomachs are now answering for you. You're like, let's get off this call so I can have lunch. So you know where we are. Just send us any of your thoughts, pick up the phone, give us a call. The winner is every month, so we'll see you in June 4th at 11 o'clock. And then on the next slide, we will add additional hours for July, August, September. And then just a reminder that everyone on this call is always invited to the steering committee meeting, which is generally the third Friday. And so we'll be back with each other in 2 weeks on May 21st. A reminder that we have extended it for an hour and a half so that we can get all our work done. There's a suggestion about having a topic on racial equity. That's a great idea, Tina, and we've got some activities that are happening with the Connecticut Equity Demo, as well as CLIP, the Consumer Leadership Involvement Project that CSH is staffing for us. So we definitely can add that to our list of topics to review in the COVID office hours. And if you have other suggestions for racial equity presenters or programs, we're certainly open to those as well. The link should be embedded in your calendar already, but if it's not, it's on this slide. And then just the last couple slides are resources that we always have available to you, but we continue to add them each month so that they're right at the top of your email list. And then the last slide is how to get a hold of Suzanne and her team, who Housing Innovations staff our Connecticut Balance of State Continuum. Any last thoughts before I send you out into your weekend?
John, I'm just going to do a plug for June 4th. We'll do a topic, and the topic is on grief and loss during the time of COVID. And we have a fantastic presenter, Whitney Wilfred, who is, some of you may know, I think she does some DEMIS trainings, but we're excited to have her. So she'll be with us June 4th.
Great. All right, and I'm going to send you off with a yeehaw. Have a great weekend, everyone. Bye.
John.
John Merz, are you wanting to stay on for a minute?
I always like to be the last to leave the party.
Yes, yes. Well, where were the drinks?